If you play sports or you see somebody that's really exhausted, what do? They put their hands on their thighs, they lean forward, and they start to really take big breaths. Diaphragmatic breathing and breathing exercises are to help, of course, strengthen our diaphragm to have better breaths, better oxygen intake to our body. It can also help us with concentration, being present in the moment, and mental clarity. It's not about getting the practice right straight out of the ground. It takes practice, it takes time. Let's talk about our lungs, our diaphragm, and how we breathe. This container represents our thorax, or our upper chest area where our lungs live. Here is a representation of our diaphragm, and our balloon is our lungs. Yes, we normally have two lungs, but for the sake of simplicity, this is going to represent both of our lungs. So when we inhale or take a breath, our diaphragm moves downwards into our abdominal cavity and it contracts. As it contracts, it creates a negative pressure system or a subatmospheric pressure system in our thorax. Our rib cage also expands and moves with the use of the intercostal muscles or to facilitate that negative pressure system. So as our diaphragm comes down, pay attention to that balloon inflates. Why does that happen? Because the pressure system is trying to regulate itself to match the pressure system in the outside. So since we are getting a subatmospheric pressure or a negative pressure system, air is going to flow in to try to match that pressure. So when we create that negative space, that allows our lungs to inflate. It's not that our lungs breathe in the air or they are expanding. We have to use our diaphragm and our muscles in our rib cage to do that. Now, do we use other muscles to breathe? Yes, we have our accessory muscles for breathing, which include our shoulders, our upper traps. If you play sports or you see somebody that's really exhausted, what do? They put their hands on their thighs, they lean forward, and they start to really take big breaths and even use these muscles to really even create more expansion in the chest from the upper areas of our body and our lungs to get more breath in. Sometimes do we see more accessory movement in breathing at rest? Yes, that can happen due to weak muscles or a diaphragm that may not be working very well. In a normal system, we really don't want to be seeing a lot of accessory muscle work during restful breathing or when we're practicing our diaphragmatic breaths or purposeful breathing exercises. What we're training is our diaphragm and our intercostal muscles to do the work correctly. So not only does diaphragmatic breathing help with strengthening our diaphragm, our muscles, improving our oxygen intake, but it can also be very helpful for calming down and regulating our nervous system. Diaphragmatic breathing can also help facilitate the parasympathetic nervous system. It can help regulate our blood pressure. It can help regulate our heart rate. It can help increase that oxygenation that our nerves and our body need. Breathing can also calm down the alarm system that gets turned on in our body during flight or fight responses or when we're scared. And it can also help us with concentration, being present in the moment, and mental clarity. So the very classic first exercise is hand on the chest, hand on the belly to do your diaphragmatic breaths. The goal is to not elevate the chest through that movement, but to really work on imagining like you're inflating your belly like a balloon. And it should look something like this. Some common things that I see done wrong is that people try to push their stomach out as they take a nice deep breath in. That is not really the goal. We want to imagine like the abdomen is filling passively because remember, the diaphragm is what's creating that negative pressure system for our lungs. Another way to do a diaphragmatic breath or get a correct breath is to imagine like there is a band around your rib cage and you're trying to push that band evenly like a hoop all out as you inhale, exhale as it comes in. This involves a little bit more of those intercostal muscles. So let's show you what that looks like. It's not about getting the practice right straight out of the ground. It takes practice, it takes time, it takes mental concentration, and it's okay to not be perfect the first time you do these exercises. Diaphragmatic breathing and breathing exercises are to help, of course, strengthen our diaphragm to have better breaths, better oxygen intake to our body. But when we're also working on the mental health piece of breath work, it is to help facilitate, again, that parasympathetic nervous system, help decrease anxiety, help with mental clarity and focus. So as you work on practicing the basic breath work. Take time, practice throughout the day, find the place that feel comfortable. You can practice laying on the ground, laying on your side. You can practice in sitting postures. You're finding what works best for you. We learned about how our diaphragm, our intercostal muscles, help to get air into our lungs. We reviewed 2 different techniques to get diaphragmatic breathing. We went briefly over on how to do some breathing practice on your own and how to master that and practice it. Now we're going to go over different types of breathing that you can also add to your practice. The first one is called box breathing. Box breathing is a great way to work on stress and anxiety and is a go-to for people who just need a quick breath work, quick moment to help regulate heart rate and blood pressure. So you want to imagine a box, and you can actually use your finger to draw that box if it helps you visualize the breathing technique. And so what you want to do, inhale for 4 and pause for 4, exhale for 4, pause for 4. You are cycling that 4-second box on each corner. That's called box breathing. Let's do that together now with breathing. Inhale, pause, exhale, pause. Inhale, pause, exhale, pause. The next is 4-7-8 breathing technique. This is helpful for winding down at the end of the day. If you're ready to go to bed and you're just trying to wind down and calm down your nervous system, particularly like to practice this at nighttime. And if you fall asleep, great, you fall asleep. You're going to inhale for 4 seconds, hold for 7, exhale for 8. Let's practice that together and what that would look like. You're going to inhale for 4. 1, 2, 3, 4. Pause. 2, 3, 4, 5, 6, 7. Exhale. 8, 2, 3, 4, 5, 6, 7, 8. Inhale. 2, 3, 4. Pause. 2, 3, 4, 5, 6, 7. Exhale. 2, 3, 4, 5, 6, 7, 8. And the last technique is breath counting. It's as simple as it sounds. This one can be helpful for focusing on the moment, help with grounding and being present. And it's as simple as counting on your inhales, being silent on your exhales, and repeating the cycle. You're going to do 10 of those repetitions and then start over. Let's practice that together. I'm counting the seconds out loud, but you are usually counting those seconds inside of your head. 1, 2, 3, 4, 5, and so forth until you get to 10. Breath work is so simple and yet so powerful. If you're more interested in topics like this, please feel free to comment, and I will see you again next time.